Hello viewers, welcome to the video lecture series for the job role of General Duty Assistant textbook for class 11th. In Unit 1 Hospital Management System, we will learn about the healthcare delivery system in India, responsibility and personal hygiene practices to be followed by General Duty Assistant. This unit explains the model of healthcare system, functioning and services of hospital, and it will give inside knowledge about role, responsibility and qualities of a general duty assistant. This unit has 4 sessions. They are Session 1 Healthcare Delivery System, Session 2 Qualities of General Duty Assistant, Session 3 Code of Conduct for General Duty Assistant, Session 4 Personal Hygiene Practices for General Duty Assistant. In this unit, we will learn about the various aspects of healthcare delivery system covered in session 1 of the textbook. Now, let us first understand about healthcare system. The healthcare system includes all the action, individual and agency whose main function is to improve health status of a person or population and to provide quality healthcare services. A good healthcare delivery system is the most important element of any healthcare system. Growth and development of any country is much depends on health of community or population. India stands at the second position among the most populous countries in the world after China. Thus, provision of healthcare to a such huge population is the biggest challenge faced by Indian government. Healthcare system has become one of the India's largest growing sector. In our country, we have mixed healthcare system inclusive of public and private health sector. So, healthcare service delivered by government and the local bodies as well. Healthcare system is categorized into two sectors, that is public and private health sector. First, public health sector. Public health sector includes primary healthcare center, community healthcare center, sub-center and government hospitals. Second, private healthcare sector. Private healthcare sector comprises private hospital, polyclinic, nursing home and dispensaries, general practitioner and clinic. Most of the private healthcare providers are concentrated in urban areas, providing secondary and tertiary healthcare services. Now, let us learn about various levels of medical care which represents varying degree of complexity. These are primary care, secondary care, tertiary care and quaternary health care. First, primary health care level. At the primary level of health care, we include primary health centers and sub-center. Here, essential care provided through A&M and ASHA workers. Second, secondary health care level. Secondary health care level are dealt by specialists in district hospital and community healthcare center. It serves as first referral level. Third, tertiary healthcare level. Tertiary healthcare level is a more specialized level provided by regional or central level institution. These healthcare center equipped with specialized instrument and expert medical professionals. Fourth, quaternary healthcare. Quaternary healthcare is an extension of tertiary care and includes experimental medicine and procedures. Viewers, many of you might have visited a hospital. Let me tell you about hospital setup, its component and its function. Hospital is an integral part of social and medical organization which provides a complete health care for the population. Hospital setup is an open system with various components like clinical, non-clinical and supporting services. All these components are integrated by a common purpose of providing comprehensive healthcare services. Now, function of hospital. The hospital play a major role in maintaining and restoring the health of community. Main function of the hospital are restorative, preventive, training and research in healthcare and medicine area. First, restorative function. Restorative function includes disease diagnostic activity, curative activity, rehabilitative activity and all emergency services. Second, preventive function of hospital. Preventive function of hospitals are supervision, control, prevention of diseases, health education services and health checkup. Third, training and research activities. training and research activities of medical, paramedical and other support staff like clinical and non-clinical. Classification of hospital is done based on the bed capacity. Hospital can be categorized as small, medium and large hospital ranging from 100 to 300 bed. 100 bed capacity as small, 200 bedded hospital as medium and more than 300 bedded hospital as large hospital. Outpatient department. In outpatient department or OPD, investigative and treatment work done without admitting the patient, thus helping the patient in bringing down the cost of medical expenditure. Laboratories. Based on the type of testing biological sample, laboratories are categorized into bacteriological, biochemistry, hematology and parasitology and oncology. Blood bank collects the blood and tests them for their safety required for the transfusion. Other departments of hospital which perform non-clinical functions and supportive services are cleaning and laundry department to take care of the entire linen of the hospital. Housekeeping maintains cleanliness of the hospital or work area. Hospital administration comprises the administrator, the assistant administrator, the business manager and the departmental heads. Purchasing department purchases all the equipment and supplies needed in the hospital, and finance department looks into the payment and budget affairs. Let us now summarize what we learned in this session. We have learned about the healthcare system in India, levels of medical care, components and function of hospital, other supportive services providing departments of the hospital. So, we can conclude that a general duty assistant work in healthcare sector and provide nursing care to the community. If you want to be a successful health worker, you need to contribute in all services of this sector. If you think you could be a competent nursing assistant and help the nation in developing human resources, learn by doing and give your best. That's all for this video, and in next video we will cover session 2 of unit 1. Till then, enjoy learning.